Okay, so picture this. A patient is in critical condition. Their heart is struggling, and the doctors need to know exactly what's wrong, like right now. But how in the world do you measure the pressure inside a beating heart without, major surgery? Well, today, we're going to follow a tiny sophisticated probe on an absolutely incredible journey to answer that very question. So that's the big puzzle, right? How do you get a pressure reading from the left side of the heart, which is the body's main pump, without actually going there? I mean, it kind of sounds like a magic trick, but it's a real vital diagnostic tool that has a surprisingly clever solution. All right, so let's set the scene. Before we start following our little probe on its big mission, we really need to understand the precise problem it was designed to solve. What we're talking about is something called pulmonary capillary wedge pressure, or PCWP for short. And the key word here, the whole secret, is indirect. Think of it like a plumber trying to figure out if a big water pump is working correctly. Instead of ripping it apart, they just check the pressure in the pipes leading back to it. It's a brilliant way to see what's happening downstream without having to go right to the source. So to get this reading, doctors need a very special tool, a kind of messenger, if you will, that can be sent on this incredibly delicate mission. And that messenger is the Swan-Ganz catheter. It's just a remarkable piece of medical tech, named after its inventors, Dr. Jeremy Swan and Dr. William Ganz. This flexible, multitasking catheter is going to be our guide for this entire journey. You see, this catheter is basically 4 tools packed into one, with 4 separate channels, or lumens. You've got the blue port, which measures pressure right at the start, in the right atrium. The yellow port is way out at the very tip, and it reads the pressure in the pulmonary artery. The red port, that one controls a tiny, but absolutely crucial balloon. And then there's the thermistor, which measures blood temperature to help figure out how much blood the heart is actually pumping. Every single part has a critical job to do. Okay, our messenger is prepped and ready to go. So now let's follow it step by step on its amazing journey deep inside the heart. So the journey begins in a large vein, usually the internal jugular in the neck. From there, the catheter is gently guided down into the heart's first chamber, the right atrium. Then, with the help of its little balloon, the blood flow itself just carries it along, right through the tricuspid valve into the powerful right ventricle, and then whoosh, out through the pulmonic valve and into the pulmonary artery. Now this is super cool. This is how the medical team knows exactly where the catheter is. As the tip moves from one chamber to the next, the pressure readings on the monitor change a lot. In the right atrium, the pressure is really low, less than 5 millimeters of mercury. But the second it pops into the right ventricle, that systolic pressure, the pumping pressure, jumps way up to around 25. These pressure check-ins are like a GPS for the heart, making sure it's on the right path. Okay, so the catheter has made it. It's reached its final destination deep inside a small branch of the pulmonary artery. And this, right here, is where the most critical part of the whole mission happens. With the catheter tip in the absolute perfect spot, the clinician very slowly inflates that tiny balloon. This gently wedges into the small vessel, and for just a moment, it stops the forward flow of blood coming from the right side of the heart. And that little blockage, that's the whole trick. It creates this uninterrupted static column of blood between the catheter's tip and the left atrium. Since there are no valves in the way, the pressure sensor can now effectively see all the way back to the left atrium and get a clean reading of its pressure. That's the wedge pressure, a truly brilliant indirect window into the left side of the heart. So, we have our number. The mission was a success. But what does this single pressure reading actually tell the medical team? What does it all mean? Well, first we have to know what's normal. A healthy, normal pulmonary capillary wedge pressure falls into a pretty specific range, somewhere between 4 and 12 millimeters of mercury. That's the number everyone is hoping to see. And this is why this measurement is just so incredibly powerful. If that wedge pressure is high, say over 15, it strongly suggests there's a pressure backup, probably because the left side of the heart is failing to pump blood out effectively. That points to a heart problem or a cardiogenic cause. But if the pressure is normal or even low, it tells the team, hey, the problem probably isn't the heart itself, and they need to start looking for other causes. It's a critical fork in the diagnostic road. And the PCWP is incredibly versatile too. It's not just a one-trick pony. It's also used to diagnose things like pulmonary hypertension, to check how badly a heart valve might be damaged, and to guide therapies in real time, like giving just the right amount of fluids or medication. It really helps them fine-tune the treatment for that specific patient. Now, as amazing as this whole technique is, we do have to remember,
This is an invasive, high-stakes procedure, and it's definitely not without risk.
So, what are we talking about risk-wise? Well, the vast majority of these procedures, about 90%, go off without a hitch. But complications can and do happen in about 5 to 10% of cases. And these potential risks are pretty significant. They can range from triggering irregular heartbeats as the catheter passes through, all the way to more severe issues like blood clots, or even, in rare cases, a tear in the pulmonary artery. This list right here just underscores why this procedure requires an immense amount of skill, precision, and care from the entire team.
And that really brings us to the most important takeaway here. For all of its technological brilliance, the success of this journey isn't just about the catheter. It's about the expertise, the constant communication, and the seamless collaboration of a dedicated healthcare team. It's just a powerful reminder that in modern medicine, even the most sophisticated tools are only as good as the human hands and minds that guide them.